Get ready, Central Georgia.
This is Alex Habersham, publisher of the Macon, Middle Georgia Black Pages. I'm happy to inform the community, particularly business owners, that we're working on a new edition of the Macon, Middle Georgia Black Pages and Resource Guide.
Coming soon.
There is an old expression that says an ounce of prevention is worth a pound of cure. And sometimes I don't think we realize the importance of that until we need the cure. So oftentimes we don't pay an adequate amount of attention to the prevention. And this is true in almost every walk of life, because if you can plan or if you can take the steps necessary, even in business, if you do a business plan and take the steps necessary to keep you from going out of business, you are likely to be successful. Well, let me tell you something that you already know. It certainly applies to health and wellness and living a good life and the prevention of and the curtailing of diseases. So today, we are so fortunate to be able to discuss not only preventative measures as it relates to a very serious malady or disease, but also, how these diseases are treated. And that we are discussing diseases and treatment because we're going to talk about colorectal cancer.
Mm-hmm.
And too many of us know, all of us know that it can be very deadly. Because I have hands-on experience, the tragedy of this disease. My mother and my brother both died from it, and I'm still hurting behind it because I know, after having done some sessions with some of the physicians and practitioners, then I know that probably that ounce of prevention probably could have saved their lives. So this is a call to action. I'm your host, Alex Habersham, and I wanted to interject that introduction, I guess, because I'm the host of the show. And I again will introduce my guest today, which is Miss Darquita Loyd, who's a nurse practitioner with Atrium Navison Health. How you doing?
I am doing awesome, Mr. Habersham. Thank you so much for having me.
Yeah, well, thank you for being. Tell us a little bit about yourself before we get into prevention and cure.
Well, like I said, I am a nurse practitioner here at Atrium Health Navicent, and I have been a cancer nurse for over 10 years. It's my passion. I love caring for those who have cancer. There's so many different elements related to cancer care and the patients that we provide the care for related to cancer. I'm a mother. I am a student. I'm a teacher. As a nurse, you're always a teacher. And I'm just grateful to have this opportunity to discuss colorectal cancer with you today.
Yeah, and I'm so happy that you're here. And then I think one thing that's often overlooked, and I'm glad you said that, because, there are all kinds of cancers,
Mm-hmm.
so, just talk generally before we get into the specificities of colorectal cancer. Just talk generally about cancer and where have you seen it in different individuals' bodies?
So, there's different types of cancer, as you mentioned, Mr. Habersham. You have lung cancer, which is basically the second leading cause of cancer death.
Wow.
You also have blood disorder type of cancers like lymphoma, leukemia. You have breast cancer, which is the leading cause of cancer in women. Prostate cancer, which is the leading cause of cancer in men. Prostate cancer and breast cancer, those are the two cancers that have the best prognosis. I would say lung cancer and pancreatic cancer, those are more cancers that have a worse prognosis. However, prevention is key when it comes to any type of cancer. And that's why we have to get that education out there to our communities, because if you can prevent and do those screenings, that means you can detect the cancer at an earlier stage. Any cancer, if you detect it at an early stage, you have a higher risk of curing that cancer versus just receiving what we call palliative treatment, just treating the symptoms.
Now that include, uh, you said pancreatic and lung. What were the ones with the lesser diagnosis? It was pancreatic
I said
and
pancreatic and lung. Those would be one.
lung.
Those
And
are the ones that have a worse prognosis. Mm-hmm.
okay, so let's talk about that before we get into, because I'm sure that some of the information as it relates to uh, prevention
Mm-hmm.
is applicable to those with the worst diagnosis
Mm-hmm.
and those with the a better diagnosis.
Mm-hmm.
So I got a curious question.
Yes, sir.
But what are the indicators for cancer?
So when you think about cancer in general, anytime you're just having, you see any lumps or bumps, abnormal lumps or bumps anywhere in your body, anytime you're having any issues with habits as far as, changes in bowel habits, changes in urinating, changes with your appetite, changes in your weight, any type of changes that you have seen in your body, that should alert you to say, I need to get to a doctor.
Okay, okay. Now let me ask you another question that I'm curious about.
Yes, sir.
Is it possible? Are there indicators in blood as it relates to whether or not one has cancer?
There are some indicators. However, American Cancer Society, other cancer organizations, there are those specific cancer screenings at certain ages, and depending on your family history, that will help to determine you, along with your primary care doctor, when you need to have those tests and screenings done. And a lot of those blood tests, a lot of those are considered genetic testing. And
Okay,
those are more so if you have that family history, you meet the criteria for those tests.
but it's possible to to have another kind of cancer that the blood won't show. So what I'm gleaning from what you're saying is that that one would need to get specific tests,
Yes, sir.
like an X-ray for the lungs or
Mhm.
whatever for the prostate or whatever for the breast or what have you.
Mhm.
So I guess you're suggesting a conscientiousness, if you please,
Absolutely.
as it relates to checking on your body,
Mhm.
and making a determination to see if, in fact, there are any problems in your body.
Mhm.
And you do that. Okay, okay, okay. Before we get to this is so exciting. Before we get to colorectal, what is the general approach to determining, like screening and otherwise, to determining whether or not you have the cancer? Suppose, say this 50-year-old,
Uh-huh.
well, I'm getting older now, so it's time for me to start. And you don't have to be 50. I know it happens all the time, but I'm just using that as an example. So, what kind of screenings? What's the screening process so we can try to engage in whatever preventative and detection methods that we can early on?
So if you are a male and you were to come in to see me for a physical exam, then there will be certain questions about your lifestyle as far as the certain things that you eat, exercise, do you participate in any physical activity, family history, along with, as you mentioned, your age. If you are 50 years of age, then I'm going to automatically ask you or tell you that since you're 50 years of age, it's time to start having colonoscopies. Other than colonoscopies, there are other stool tests that can be done to detect blood in your stool, DNA, abnormal DNA in your stool and blood as well to help detect colon cancer. I would also ask you as a male, have you ever had prostate screening? Have you had a PSA level drawn? Have you had a prostate exam? You would want to do those things. American Cancer Society recommends having prostate screening starting at the age of 50 and starting earlier for African American males, just simply because there's a higher risk of prostate cancer in African American males. If you are a smoker, if you are a smoker who have quit smoking within the last 15 years, then I would ask you, how much did you smoke? And then I would ask you, if you are still smoking, how much do you smoke? There are low dose CT screenings that we actually offer and provide for those patients who meet the criteria. Low dose CT screenings, what they do is they can detect small pulmonary nodules that can actually determine whether or not it could be lung cancer, the beginning of lung cancer, or it could just be nodules there in your lungs that need to be followed. Now, if you're a female, questions I would ask you are, if you're 50 years old, I would ask, have you had a mammogram? Because as females, you should start having mammograms at the age of 40. You should start having them before the age of 40 if you have a family history or a personal history of breast cancer. I would also ask you information about exams with the OBGYN. Have you had a pap smear for cervical cancer? So those are certain questions and certain things that would be asked based on your age, your diet, your physical activity, and just your overall lifestyle.
So I guess the crux of what you're saying is that one would need to be proactive. And I think that's, it's so sad, when a person is either ill or passes, and I know it's kind of harsh, but I'm going to say needlessly.
Mm-hmm.
And I say needlessly because there are certain actions and certain steps
Mm-hmm.
that we all could take, depending on our lifestyles and what have you. But I think I hear you saying that one does not need to wait on a sign, that you got to be proactive in trying to do the screening based on your gender and your lifestyle and other kind of indicators, if you please, that may be prevalent if in fact you have that problem.
That's exactly what I'm saying. You cannot wait until you see see some type of sign. Actually, a lot of times for certain cancers, when you see certain signs like ovarian cancer, sometimes when you see certain signs, that means it's kind of late. It's already in the late stage. So that's why it's very important not to wait until you see a sign or a symptom. Just go ahead and have those screenings as they're recommended, as well as depending on your family history.
Now, so I mean, I guess it would take there's no way, there's no one size fits all, I guess, as it relates to cancer detection.
No, sir.
It's gonna take, I want to say, I'm gonna call it extreme conscientiousness
Yes. Yes.
as it relates to checking on yourself and being happy and things of that nature.
Yes.
So I mean that is that's very, very important. And I guess what you and I both are trying to do, Darquita Loyd MNP, is that we're trying to project and prick, if you please, the conscientiousness of the listening audience because we want everybody, to live a long time and to be, if not cancer free, to detect it, as soon as possible.
Yes.
Now, I guess we can get to colorectal cancer
Yes.
because, I mean, we need to walk through, you know, the prevention and treatment
Mm-hmm.
of colon cancer.
Mm-hmm.
Unfortunately, I think my brother, I don't know what happened to my mother. The only thing I remember is that I saw some weight loss.
Mm-hmm.
I kind of noticed that she had been losing some weight. And then later on, I could tell that she was losing her hair, but
Mm-hmm.
that may have been because she knew, and she was getting treatment, and she did have it, but I had no idea.
Okay.
So what I'm trying to suggest is that we all need to be conscientious about that and try to look for the signs. So I wish you would again kind of go over, what needs to be done to detect it if possible,
Sure, absolutely.
or to detect it or see, and then we also need to get into while you're talking, maybe some of the habits that you can do food wise, diet wise, exercise wise, that one in which one can engage
Mm-hmm.
that would help to kind of prevent it.
So let's start with the fact that there are risk factors that you mentioned. Yes, there are risk factors for colon cancer. There are risk factors that can be modified, meaning someone can change those risk factors. And then there are also risk factors that cannot be modified. So let's talk about the ones that can be modified, the things that we can do to keep us from being at such high risk for colorectal cancer.
Right.
So you want to think about exactly what you said. What are you eating? What are you putting in your body? Are you eating a lot of red meats? Are you eating a lot of processed meats, hot dogs, luncheon meats, and things of that nature? You want to make sure that you are not obese, overweight. You want to make sure that you're being physically active. What does that look like? At least maybe 3 times out of the week, you're doing some type of physical activity for at least 30 minutes. Smoking also puts you at high risk, and increased alcohol intake. Now, those are all the things that we can modify, all the things that we can change. Now, when you talk about those things that we cannot change that puts us at risk for colorectal cancer, that's where you get into your family history. A lot of times we have a family history where it is genetic, and we have these type of familial mutations in our genes that cause us to have colorectal cancer. We can't change those or do anything about that. But what we can do is, if we know we have that, or a family member has that genetic mutation, we can let our doctors know so that we can get our testing and screening done at an earlier age, so that it could possibly be detected in us earlier versus later.
So even though I may be genetically inclined,
Mm-hmm.
if in fact I get the examination, then it's still treatable. Is that correct?
It's absolutely treatable. If your cancer is detected at stage 1, 2, or 3, we can definitely treat your cancer. Your cancer could be treated with surgery, chemotherapy, radiation, one of those, or a combination of 2 or 3 of those. It depends on the stage. But the goal is to detect it when it's stage 1.
Talk about a colonoscopy and talk everything about a colonoscopy.
Okay.
Role that it can play, blah, blah, blah.
Now, a colonoscopy, what you want to do is you want to get a colonoscopy starting at the age of 50, unless you have a history of precancerous polyps, unless you have a family history of colorectal cancer, you have any type of abdominal disease like ulcerative colitis, or Crohn's, IBS, or anything like that. Now, when you have a colonoscopy, basically what they will do is they will give you some local sedation, and you will not know what's going on. You'll be asleep. And what they're doing is they're taking a camera, and that camera is going to, small tube is going to be inserted into your rectum. The doctor is going to look very good in your rectum, make sure they don't see any polyps, any masses, anything bleeding. They're also going to look at your entire colon, small and large. They're not just going to go to the lower half of your colon. They're going to look at your entire colon. They're going to make sure that they don't see any polyps. If there's any polyps, which are considered precancerous or can be considered precancer, they will remove those. Anything that they see abnormal, they will remove, send off to pathology, and then let you know what those results are. Now, depending on your colonoscopy, that determines how soon you will have another one. If your colonoscopy turned out okay, if it was normal, your doctor will suggest that you have another one in 10 years. Some people have to have one in another 5 years if polyps or there's been any abnormalities or diverticulitis or anything detected. Some people have to have them much sooner. Some people have to have colonoscopies every year, especially if they have a history of having colorectal cancer. I think a lot of people in our community are under the impression that a colonoscopy may it may be invasive, it may hurt, but what I want everyone to know is that colonoscopy, during the time that you're having it done, you don't know what's going on. It's the best preventive measure that we have out there to detect colorectal cancer. And if it's there and you're getting the screenings done the way it's recommended, it's very possible that we can detect colorectal cancer early.
Same kind of attitude is taken about the COVID vaccine.
Yes, sir.
And I think we would be remiss if we didn't kind of draw an analogy here.
Yes,
You
sir.
know, just like people, are reluctant, to have a colonoscopy
Mm-hmm.
because of the possibility of a little pain, then we got a group of people who have the same kind of reluctance as it relates to the taking of the vaccine.
Mm-hmm.
And then, even after having realized and after having seen, and I've got a lot of friends who absolutely just died, you know, as a
Mm-hmm.
result of COVID. So I guess we need to say a word or two to encourage people about the vaccine while we're talking about diseases and invasions and things of that nature.
Absolutely. I'm happy that you mentioned that, the COVID vaccine, there are 3 different vaccines that are out right now. It's so very important to get the vaccine if you do meet the eligibility criteria. Because, if you do detect COVID-19, you do detect the virus, unfortunately, we really don't have the research out there to help us to know whether you will be one of the ones who have mild illness, you have severe illness, or if, it may cause death. So that's why it's important to go ahead and get the vaccination. Prevention is key. There again, prevention is key.
So talk about, since this is colorectal cancer month,
Yes.
talk about certain signs again that
So,
that may be prevalent if we have colon cancer.
okay. So first thing is, if you ever see any blood in your stool, you need to get to the doctor. No one should have blood in their stool when they have a bowel movement. Or if you see blood when you're wiping after having a bowel movement, you need to get to a doctor and let them know what's going on. Any changes in your bowel habits. And when I say changes in your bowel habits, that means, constipation that's not relieved with any over the counter medication, or abnormal diarrhea that's not relieved, that's been going on for a while. If you start having any abnormal cramping in your belly or your pelvic area, those are some of those early signs of colorectal cancer. Now, you mentioned, Mr. Haversham, that I believe one of your family members, your mom, had some weight loss. Weight loss is normally seen as one of the later side effects of colorectal cancer. So unexplained weakness, fatigue, that weight loss, because the cancer is feeding off of everything that you're giving your body. So you have that weight loss. I would say the changes, like I mentioned, the changes in the stool that last much, much longer. You may develop some vomiting because, of course, remember the colorectal cancer could be in your actual colon, part of your colon and your rectum. So it could be blocking off the passing of your stool. So you could have some vomiting, you could have some nausea. So those are some things that you want to look for anytime any of those things arise. You want to get to your doctor.
Talk a little bit, because we're kind of coming up to the end, about the resources that are available to kind of, particularly through Atrium. I know that Atrium does a phenomenal job of trying to provide resources to the community as it relates to the health and education and prevention, but specifically as it relates to cancer. What are some of the steps, resource-wise, that individuals can take?
So the Cancer Life Center here at Atrium Health Navicent, if anybody would like to get more resources through our Cancer Life Center and speak with one of our cancer navigators, we have 3 nurse navigators, one that focuses on breast and GYN, one that focuses on colorectal, and one that focuses on lung. So if anybody wants to get information as far as screening for any type of cancer, not just colorectal, they are welcome to call our Cancer Life Center, which is 478-633-8537, and ask to speak with one of our cancer nurse navigators, and they can navigate and help with any resources, answer any questions related to any type of cancer screening.
And then I think that it needs to be noted that too often, we don't recognize and realize and take advantage of many of the resources that are available for a whole lot of things in our community, particularly health. So it just doesn't have to be cancer. I'm sure that one can call the general number for Atrium Navicent and find out information about a whole lot of things, whole lot of resources, clinics, whole lot of educational seminars and what have you. So I just want to say that this is a call to action. I'm your host, Alex Havisham, having interviewed Ms. Darquita Loyd, NP, who has done an outstanding job of educating and informing us about colorectal cancer and other kinds of cancer. Thank you so much, Ms. Loyd. I really appreciate it. This is a call to action. I'm your host, Alex Havisham. Have a great day.
Get ready, Central Georgia.
This is Alex Havisham, publisher of the Macon, Middle Georgia Black Pages. I'm happy to inform the community, particularly business owners, that we're working on a new edition of the Macon, Middle Georgia Black Pages and Resource Guide.
Coming soon.